Have you ever been tempted just to run a few more tests? Maybe a stool test, a food sensitivity test perhaps, or a hormone panel, just to see. But then you felt even more anxious than you started. In today's episode, we are going to be talking about the testing trap, how excessive medical testing can actually do more harm than good, leading to more testing and more invasive tests and more treatments that may actually be unnecessary, creating more anxiety and more problems. Hi, and welcome back to the Good Gut Feeling podcast, where we digest modern medicine with old world wisdom. I'm Dr. Alexandra Shestina, and I am your host for this weekly podcast. And today, I'm excited to talk about this because I hear this so much in my practice, so it's very likely that you have the same questions. We are now in the era with overwhelming amount of data. We don't even know what's true anymore. There was a time when people went to the doctor to get an answer. Now they bring answers to the doctor. And sometimes those answers are so confusing for the patient because of information overload, and you don't even know what's true. But how does this apply to testing? Because there are many people who believe more testing is better because what's the harm? Hey, it's just a blood test. Hey, it's just a stool sample. They're not invasive, so why not? Why not get more information? In these days, there is a test for everything. There's the standard test, there's the functional test, and then there's the extra tests. But here's the thing, more tests does not always equal more clarity. Why is that? Because sometimes even good tests just kind of show normal fluctuations, and they're a snapshot of what's going on at that moment, and that can shift. And those shifts can be scary, but the question is, are they necessary? And most of the time, the answer is no, because there is a very specific way to test. And this, I believe, is actually done very well in the medical world, because the way I was trained in medical school is that you don't do a test unless it's going to change your management. There has to be a reason you order the test. And there has to be a thought process. It's not just, let's just test everything and see what happens. That never worked. You have to have a thought process. You have to have a working diagnosis. And then you test that working diagnosis. And then the results should change your management. Right now, we have so much technology. And it's so easy that doctors now have become technicians because all we really need to know is what tests to order. We don't even need to think. And you know, the old doctors, those old school doctors that trained me, and you know, when I was training, some of them were in their 70s and 80s. And they didn't have all those tests. They weren't ordering tests on everyone, not MRIs, not CAT scans. It was very selective. And they were able to diagnose patients based on their physical exam, based on the nuances of their history, based on their intuition. And they were usually right. And you know what? That was a real doctor, because those doctors use their brain and they use their common sense. They didn't need just to order a lot of tests, like many doctors do these days. Let's talk about the kind of testing that exists, because they're not all created equal. There's the standard conventional testing. These are the established tests. They're the tests that have been around for a long time. They have reference ranges that have been tested, and they've been used so much that we kind of know that they're pretty good, that they have a pretty good sensitivity and specificity, and we can kind of rely on them. But I'm going to give you a big but. Even the best test, even the oldest established test, is never 100% accurate. All tests have a sensitivity and a specificity. And sensitivity means, do they pick up that condition that you're testing for? If that test is testing for a condition Y or X, or how often does it actually pick it up? Like, are there some times that it's not picked up? And then there's specificity, which means, are all the positives actually positive? So we get a positive test. Is it a real positive or a false positive? And there's not a single test that's 100%. Even the old tried and true tests are not. Then there's the functional medicine test. And I get those a lot as second opinions, and I'm going to tell you they are so frustrating because these tests have the same limitations as a standard test and more because these labs, their reference ranges are proprietary, their own, and they're not often reliable. Not to mention these tests are not standardized. They're kind of still experimental. So there are some better ones. We have a stool test that's probably the best on the market in my practice, and yet I rarely use it because these tests cannot diagnose. They are not established enough for me to say that you have a condition that needs a medical treatment. And I have seen many patients who have been treated medically as a result of these experimental tests. And they come to me with certain results that are very concerning to them. But to me, I know that they're not because these reports are not regulated by a standard. They are the company's ranges and they are not reliable. So can they give you a snapshot, a glimpse, an idea of what's going on? Absolutely. Yes, they can and they do. And for that, they are good, but they are not for diagnosis. And I can give you numerous examples. I had a patient come to me for a second opinion. Her functional medicine doctor said, you need to start on antibiotics because of a stool test that showed an overgrowth of some pathogen, of some parasite. And her inflammatory marker called calprotectin, which is a marker of inflammation in the gut, was elevated. And what was the problem with that? First of all, calprotectin is a specific marker used in inflammatory bowel disease. And it's not just supposed to be used for everyone. It's not just a screening test. It's a test used and it's not even, and truthfully, it's not even a diagnostic test. It is a test that shows inflammation in the gut for specific conditions. You don't just test it on everyone. The second problem was the lab. And this is a very established stool test lab that you may have had your stool tested. But their reference ranges, their standardization is not as reliable as some of those kind of tried and true lab companies that, you probably have heard of, that take your insurance. Anyway, she had no symptoms of this parasitic infection, but she had this abnormal test, 2 abnormal factors on this test that led her functional medicine doctor to believe she had an infection that needed to be treated with pharmaceutical, antimicrobial, anti-parasite medications. I said, just let me retest your numbers. Just let me retest it on the standard lab. And guess what? It was normal. And I have seen that so many times. I have seen patients diagnosed with serious pancreatic conditions based on these tests that come to me for a second opinion because they're worried they have pancreatic cancer because some of their markers were off in a lab that is not reliable to test these markers. And when we test them in another lab, they were normal. I have seen this so many times. Now, let's say some markers are actually accurate. It really depends on the test because a lot of these tests are experimental. What does that mean? That means we don't know how reliable this positive tests really are. Do they really say they have this condition? Like, how sensitive and specific are they? Because they're new and they're not truly standardized to test any condition. So we really can't say that. So the best that we can do is get a snapshot. We get an idea of what's going on to put it together. But as a doctor, you're not just supposed to rely on tests. You're supposed to rely on clinical knowledge, on a good history, on a physical exam, and then you already have a working diagnosis. And then that is a good reason to test. If you have a good clinical working diagnosis, then the test has value. If you just order it just because, it really doesn't. I'm going to give you another example. Food sensitivity testing versus allergy testing. So allergy testing, there's a number of ways to test allergies, but one of the ways is a blood test. It's an IgE test, a specific kind of antibody that's related to true allergies. And that is a much more reliable test than the food sensitivity test. And sometimes I get people who come to me and they have elevated values and they have no reaction. And it was just done. I looked into it because truthfully, as a gastroenterologist, we didn't order it that much. We usually sent those to allergists. And so I called an allergist friend, and the answer is really interesting. I asked, if these slightly elevated values, what do they mean? And the answer I got is that they mean nothing because they have to be significantly elevated and in context with a clinical picture. So I eat a peanut and I feel bad. And then I have a blood test. It shows that I have this elevated antibody, significantly elevated antibody, and I have a reaction. Well, that makes sense. That confirms an allergy. But if I don't even have reaction, I'm just throwing a lot of tests at the patient, and it is very possible that the values are slightly elevated. It does not mean the person has an allergy. And this is a good test. And these are ranges that have been established and standardized. And even in this case, it still needs to be taken with a grain of salt. Now, then we take these food sensitivity tests. And you may have had one. They're almost irrelevant because they don't necessarily mean anything at that moment. First of all, it's a snapshot. Second of all, it's an antibody, and it doesn't mean the person is sensitive to this. The person may be sensitive to this, but they may not be, and the test doesn't make it more reliable. In fact, I never use those tests. You may be thinking, okay, well, that's discouraging because you may be thinking exactly what a lot of people ask me. Well, how do you know if you don't test? Well, if I only knew because I tested, then I would be a technician. Then someone could take a course of what test to order the test, and now people are doing that because a lot of things are available as, initiated by the patient, and they're marketed to the consumer. What's the point of having clinical experience and intuition and understanding and common sense? Because doctors are not supposed to be technicians. We are supposed to have an understanding of what we're testing, why we're testing, and sometimes we don't need to test. I'll give you another kind of funny example. I had a patient come to me with a stool test. I get a lot of these stool tests. They came to me with a stool test, a before and after, and they were treated with antibiotics. And they had symptoms, not clear. These were not like infectious symptoms. They had some chronic bloating and gas. And they did 2 tests. One test showed this overgrowth. They were treated with an antibiotic, and the second one didn't. And they said, wow, I was successfully treated. I said, but do you feel better? And they said, no. I said, so they treated the test and not the person. And we see this a lot. The point is not to get a non-standardized proprietary test negative. The point is to get you feeling better. And now there are a lot of people that are directing their own testing. And it seems to be the limitation is what they can afford, because I've seen people get brain scans and full body scans and all sorts of testing. And sometimes there are things that are found and they get more scared. And now we have to follow that. We can't just leave a positive test. We actually have to follow it. And oftentimes it's nothing. So the question is, when you want to get a test, number one, what question are you trying to answer? It should be specific. What is the specific question you are trying to answer? Number 2, will the result change my management? Will the result change my treatment? And number 3, am I testing this out of curiosity, out of a desire to be healthier, or out of fear? Because there are a lot of people that want tests because they have anxiety about their health and they feel the test is going to solve that anxiety. But guess what? It never does. Because there's always another test and another test, and then some of those tests are positive, and then that creates even more anxiety. So testing is powerful, but testing should be used with wisdom, with knowledge, with experience, with common sense. It's not just throw everything into the pot and hope we find some kind of answer. It doesn't work like that. So what can you do? What if I told you the most accurate test is already within you? So if you feel something's off, then there is something off. Then that requires common sense and strategy, which may require testing or may not require testing. And outside of the normal standard screenings that have been proven, and even those, by the way, are not perfect, getting the extra tests just in case, just to know why not, is not helpful, because they come from a lack of trust within you, because your body already knows and your body has the intuition. And if you came from a place of trust and calm and peace, then the answer would be pretty clear. So what is the best thing that a doctor can do for you is get you to that place of clarity, not through excessive testing, but through strategy, through calming your nervous system, through helping you with real prevention, which is a good diet. A good diet doesn't just mean an organic diet. It does mean that it should be clean because toxins are good for no one. But it also means that the right foods were selected for you, not for everyone else, and not what's on social media, and not even the diet du jour. But what is the right foods for you to get you to your best state of health? And that will also shift as you shift, because you may be feeling so-so today, and then your diet's going to be a little more restricted. But tomorrow you feel great, then your diet can expand. And the best thing that a doctor can do is connecting you to trust over fear. In the end, testing should be a guide, not a compass. It should inform you, but not define you. So next time you want to do a test just to check, take a pause and ask yourself, what am I really seeking? Data or a deeper connection with myself? Because sometimes the most healing choice is not another test. It's learning to listen within. Thank you for tuning in today. If you found this helpful, please subscribe, like, and turn on notifications so you don't miss an episode. And if you have a friend who has questions about testing, please share this episode. I look forward to seeing you all next time. Stay healthy, stay gutsy, and thanks for tuning in.